Hello everybody, I would like to welcome every one of you to the GENQA Focus On webinar today. This meeting focuses on genetic counselling. I'm Dr. Katrina Rack, and together with my colleague Melody Tabiner, we are responsible for the delivery of the clinical genetics and counselling EQAs. Today we are pleased to have two of our genetic counselling assessors, Vigdis Stefansdottir and Francesca Catapano, and they will be able to present to you today. At the end of the presentations, we will have a questions and answer session, so please submit any questions you may have via the question box in this webinar. Our first presentation today is by Vigdis Stefansdottir. Vigdis works in Reykjavik, Iceland, and has been at the forefront of developing genetic counselling as a discipline and working at a European level towards training, harmonisation and recognition of genetic counsellors. She was the first genetic counsellor in Iceland and was the only one there for 12 years. She is a member of several national and international boards and committees, and she is currently the president of the Icelandic Society of Human Genetics. I will now pass you over to Vigdis, who will talk about the organisation of genetic counselling in Europe. Over to you, Vigdis.
Good day to all of you. As you said, my name is Vigdis, and I live and work in Iceland, and I hope you can all see my slides. If not, please let the organizers know. I'm going to talk about genetic counsellors in Europe. So let's see how this works. So in 2017, there was an article that gave information about how many trained genetic counsellors there were in the world. And as you can see, there are not too many. And there's constant need of adding to the number of genetic counsellors everywhere in the world, and it's the profession is getting more and more recognized as an important part of medical genetics. A European Board of Medical Genetics has a page where there's a specific page for genetic nurses and genetic counsellors, and there's quite a lot of information there, and it allows us to assess genetic nurses and counsellors all over Europe. However, the guidelines or the registration process changes from year to year. So people who want to get a recognition, they would have to read through the regulations. But this is a very good page and lots of information on it. So, as probably all of you know, the genetic counselling job is very diverse, and it takes to in every part of medical genetics, and even beyond that, because genetic counsellors also do some psychosocial work and support work. So all these oncogenetics, neurogenetics, cardiogenetics, and all that, it's part of genetic counsellors' work. And we do touch the life of people from before they're born and until they die. So it's a long road, really. And the journey to diagnosis can be very long and very difficult if it's a rare disease. And I think this drawing does give a good information about that. And maybe most of you know that when it's not a clear diagnosis in the beginning, it takes a long time and many roads to get there. And all over the this road, genetic counsellors come in and can be of help. So what do you have to do? What do you have to know or be able to do if you are a genetic counsellor? Of course, you have to have the counselling skills. You have to be able to talk to people. You have to be able to listen, which is a very important part. And you have to be able to counsel people through the journey, the genetic journey. And on the road, you will meet psychosocial issues. You will have to explain medical genetics, human genetics, ethics. You have to go through all these and be fairly competent that you can meet people where they stand and however their situation is. And to do so, the training needs to be in first and foremost in communication as counseling skill, because if you can't listen and can't explain things to people, you really can't do your job. So it's a very important part to learn to listen. And you have to be able to assess the psychological state of the patient, because people can look quite normal and like us listening and understand what you say, but a few minutes later you realize that they really haven't understood anything because they're in shock, or they just can't grasp what's happening. And to facilitate the decision making about, should people have genetic testing or not, it's not ours to decide. It's the person's, it's the counselee's, and we have to support them, and we have to help them to disclose the genetic information to others if there's a genetic information to disclose. Also to explain why we can't reach any genetic information, why we can't find the cause. We have to prepare people for the diverse outcome of genetic testing, and be very sure that we do not judge. And the supervision is really important. When I started as genetic counselor, I couldn't have any supervision because I was the only one and there was no one else in Iceland. So I do think, looking backwards, that it's very important to have a supervision. So you should try to get one if you can. Well, another thing that's important to know how to do is to draw and interpret pedigrees. Drawing a pedigree really does become a second part of yourself. So I sometimes joke about that. I can't talk to anyone without drawing a pedigree, and I know it's I don't really do that, but it's sort of part of me. But you have to also be able to explain the inheritance mode, and do that in a language the patient understands. And you have to know where to get the medical information you need if the patient doesn't have it. In many countries, there are many places you have to look. Iceland is, well, I'm lucky in that way. We only have one main hospital, so it's not very difficult to get, but in other countries it can be very difficult. And be able to interpret the test results, to explain them, and to assess the genetic risk for the patient, for the relatives, and who should have testing and who not. And it's also important to use ethical legal framework wherever you are. That's also very different between countries. And when you need informed consent, it's not always needed, but at least it's verbal consent for having testing is needed. But sometimes you need to do more, especially if there's a lengthy research included. And you have to use a reflection when you speak to people, and be very much aware of your own limitations, because even though we know quite a lot of genetics and ethics and about framework, we don't know everything. So it's very good to be able to know when to seek help and guidance. And overall, it's a need of being non-directive. Even if you're supportive, you have to be direct and non-directive, because it's always the choice of the person in front of you what to do. And again, I know I'm pressing this, but it's very important to be sensitive to patients' concerns and psychological needs. So placement is a good thing to do if you can, to be somewhere where there's a trained professionals that can help you to understand and know how to work. And it helps you to manage then the caseload, because you learn how to do it in a busy clinic, and work with a multidisciplinary team. That's really important as well, because then you know the roles of everyone. And how to, again, develop the counseling communication skills, because practice makes perfect. So genetic counselors, they contribute to genetic health services. It's usually, and I think all countries, genetic counselors are not as expensive as medical geneticists or doctors, but they can do quite a lot of the work, and they can take some of the workload from those professionals. Genetic counselors usually have better accessibility to patients and families. They have more time to talk to them and listen to them. And they're really relevant for the quality of healthcare services. And the 2 articles that are shown there are good to read to get background information. I think the one of them will be explained better later. So we have had the genetic counseling quality assessment now. It's the 2nd year, and we've learned quite a lot over this time. It's a bit different from the molecular, biochemical, and cyto assessment, because it has more to do with how you do things mentally and how you listen to people and talk to people than lab work. So in many cases, it can be quite difficult to assess, but I think as we learn, we do more, we learn more. So the assessment sort of needs to understand how you, through your writing, through your replies, what comprises the genetic counseling visit, how you explain the inheritance pattern and genetic issues, and if needed, the disease, and how to communicate and how you show the counseling skills through your writing. I know it's difficult to do through replies, but it is possible, and how to explain the outcome and decision making and all that. So what in my opinion, the answers should show how people understand, how they explain, how they do counseling, and how they do the support. Because if you think about it, getting a genetic result that tells you that you are at risk of some disease can be the most important meeting that you have in your lifetime. It's really, really important to do it well. So I think we will focus the ECOAS more on the aspects that we have learned now for the last 2 years, and try to look more at the counseling skills than the molecular skills or the testing skills, because that's other people's jobs really. But I know in many countries it's the same person or similar persons that do the both. So it may be a bit tricky, but this is for me, the genetic counselor is the bridge really that helps to explain to people and in many ways does the same work as the medical geneticist or the doctor, but has maybe different skills to do it. So this is what I was going to tell you today, and thank you for listening. And I would like to thank Christophe Cordier for supplying the material for the talk. He couldn't do it himself. Thank you.
Thank you very much, Vigdis, for that talk. It's very, very interesting, and it explains the role of the genetic counsellor and how things are organised by the European Society of Human Genetics for counsellors in Europe. So we can now move on to our second presentation, and our second presenter today is Francesca Catapano, and she works in Bologna in Italy. She's a qualified genetic counsellor and has graduated from the University of Siena. She's currently studying for a PhD at the University of Bologna with a focus on prenatal genetics and pediatric genetics. I will now pass you over to Francesca, who will talk to you about the role of the genetic counsellor within a multidisciplinary team in Europe. Over to you, Francesca.
Thank you very much for this presentation. Okay, perfect. So good morning, everyone. This was my thesis work, and it's now a paper, and I would like to discuss with you what we discovered, because as was mentioned before, the role of the genetic counselor is becoming more and more important in everyday clinical practice. So the purpose of this project was firstly to investigate what was the role of the genetic counselor, so his field of action and the competence. And in addition to that, we would like to investigate how a team should be composed when taking care of patients affected by or at risk of developing genetic pathologies. I start this presentation in 3 sections. We will have a brief analysis of the context that we will go through really briefly because it was already explained really good, and then explain you our direct survey and the conclusion that we obtained. So as was just discovered, the genetic development we are experiencing is really big, and this has led to an understanding and management of common and rare diseases, and also to a better treatment of the disorders and response to therapy. It's because of that that genetics is becoming a predominant discipline and has an impact of everyday clinical practice. Indeed, genetics has enabled us to go through a personalized medicine, and this is not really congruent with the fact that a lot of people that works in the clinician fields do not know a lot of information regarding the genetics itself. So what we will do, what we would like to do was investigate what was the role of the genetic counselor, and we start to do that by asking us some questions. As you can see here in the left part of the slide, I put our research questions that I'm going to read to you now. So our first question was that if there was a different attribution of importance to activities that are planned that we do during the genetic counseling session between people that work or do not work with the genetic counselor. Indeed, our hypothesis regarding this first question is that there was an assigning of different value to the actions depending or not the collaboration with the genetic counselor was stated. Our second question was if the effective counseling required the team to be composed of several professionals, indeed to be multidisciplinary, and our hypothesis was that the role of the genetic counselor was fundamental in the team. Our third question was that the genetic counselor can play a marginal role in the patient care. Indeed, we thought that the genetic counselor was not recognized to be able to carry out all the action that characterize counseling session. And our fourth question was regarding the difference depending on the country of origin of the people that were answering our questionnaires. And our hypothesis was that the first one is that there is different knowledge of the counselor depending on the country of origin, and also the collaboration with the counselor itself was different regarding the countries of origin of our medical doctors that responded to our questionnaires. So what did we do? We decided to carry out this survey. So the first things we draw our survey on a platform that is called Qualtrics. As you can see in the right part of this slide, the survey was composed of 5 sections. At the beginning, there was a concept form, and then a sample characterization with the gender, the age, and the sector of work of our medical doctors. Then we had a focus on the counseling procedures, where 25 items were stated, and the doctors have to rank how much these items were important in the counseling session. Then we have a section regarding the team composition, and then at the end, a section regarding the role of the genetic counselor that I briefly will explain to you later. For doing all this statistical analysis, we use Likert scale from 1 to 7, and we were investigating the level of agreement of our participants. We obtained 200 answers from all medical doctors from all over Europe. So starting with the results, as you can see here, the majority of people that answer our questionnaires were female, and they were quite young because the majority was less than 40 years old. Here you can see the country of origin, so the majority of answers were obtained by Spain, Italy, and Germany. So we were asking the occupational field, and the majority of doctors worked in pediatric and syndromatology genetics, followed by prenatal and oncogenetics. More than a half have a work experience this less than 10 years, and then 63% work in a public sector. In these two boxes, we asked the awareness of the profession of the counselor, and as you can see, 95% of the doctors stated to know what is the genetic counselor profession, but just 61% of them have collaborated with a genetic counselor. Regarding the section of counseling procedures, here we stated 25 items, and they have to rank how much these items were important for them in the counseling session. I reported here just the 10 more important, and as you can see here, I highlighted you this one because we conduct a statistical analysis regarding these 4 items, and we saw that there were difference regarding the people difference in importance given regarding people that work with a genetic counselor and people that have never worked with them. So I'm gonna read these to you because I think they are quite important. So as you see, they are inform the patient about familial risk without known mutation, guide the patient in making the right decision for themselves, inform the patient regarding pre-symptomatic tests, and inform the patient about the VUS. So the people that work with the genetic counselor have given an higher average values regarding these items, and this, in our opinion, highlight the importance of the patient-centered approach. Moving forward, we were asking again to state how much these professional figures that you can see here in this diagram were important in the theme of people that have to carry out of people with genetic conditions. As you can see here, obviously the geneticist is the more important, but is followed at the second place by the genetic counselor. Again, here we see if there was statistical significance, and we saw that people that had worked with the genetic counselor have given a higher value. This means that after working with the genetic counselor, the doctors underlined more the importance of this figure and want to collaborate even more. But on average, even people that have never worked with a genetic counselor put them second just after their own profession. So in this section, we highlighted the importance of the multidisciplinary team and also the importance of the genetic counselor itself in the team. Here we did just a focus on pre-implantation genetic tests, and what I want to underline in this slide is that here we have the most important activities in the field of PGT, and as you can see, inform regarding reproductive option and make a genetic risk assessment, and for prenatal testing that are the most important one, are the one that are ranked also in the top activities for importance, and are all in the semantic field of the role of the genetic counselor. Again, here the genetic counselor is second for importance also in the PGT field. So again, it is really relevant in the multidisciplinary team. This slide is quite complicated, but I'm going to explain to you because it was really important for us when we discovered this result. Because in the role of the genetic counselor section of our survey, we put the same item that has to be ranked for importance in the previous section, and instead here we were asking if the doctors let the counselor do this these items, if they agree that the counselor was able to perform this activity, was inherent with the genetic counselor job. What was really interesting is that if we compare the top activities that should be performed in a genetic counseling section and the activities that should be performed by the counselor, we can see that 9 out of 10 concede regarding the importance and the one that the counselor should perform. We know that there is a discrepancy with the items give test result to the patient because it's ranked 9 for importance and just 12 for correlation with the activities of the genetic counselor. And we know that there is a debate regarding giving the test result by a counselor, but at the same time, the authors thinks that it's really important that the person that saw the patient at the beginning of the counseling session is the one also that gives the result at the end of all the pathway that a patient should go through. We move forward regarding which was the most important field, in their opinion, in which the genetic counselor could express himself. And here we have oncogenetics, followed by prenatal and preconceptional. But we were really happy because we put a section that is called other, and here a lot of people expressed that the counselor should be present in each disciplines of the medical fields. And this is in agreement with what we stated at the beginning, that genetics is becoming really predominant in each field. And regarding the background for the genetic counselor, we have biology and nursing that are the most important one, the most ranked one. And we think that it's really important to unify at a European level the degrees that give the access for the genetic counseling training. And again, here we can state how the importance of both theoretical and clinical practice arise. So in conclusion, our first hypothesis was accepted. Our second hypothesis regarding the role of the genetic counselor fundamental in the team is again accepted. And regarding instead the difference between the country of origin, the first one indeed is not accepted, maybe because we didn't have enough data. And regarding the fact that the genetic counselor is not able to carry out all the characterized counseling session, we rejected this hypothesis because indeed, as you see, it's really important to have them in the team. So I leave you here the QR code for the article that has been published a few months ago in the European Journal of Human Genetics. And I'd like to thank you for your attention, and also all my team that helped me, especially Prof. Cordier, in the development of this paper. Thank you so much.
Thank you, Francesca. Thank you, Francesca. That was a very clear presentation about the role of the genetic counsellor in Europe, and it was nice to see that you're very much appreciated by your colleagues of within the multidisciplinary team. If anybody has any questions that they would like to ask the two presenters today, please put your questions in the question box, and we will pass them forward now to the presenters. There aren't very many, but please do put them in if you have anything that you would like to ask them. So one of the questions that we've had is that they can see that we offer quite a lot of different EQAs for clinical genetics and counselling. We currently are offering 4 clinical genetic EQAs for cardiogenetics, dysmorphology, monogenetics and oncogenetics, and then we have additionally the genetic counselling EQA. So they were wanting, the question here is, what difference is there between the different types of EQAs offered, and which one should I participate in? Well, as I think Vigdis explained earlier on, we've learnt a lot through running the genetic counselling EQAs this last couple of years, and I think that we have learned that for the genetic counselling EQAs, we are going now to focus much more on the counselling skills rather than on the genomic medical test interpretation. So those are the things that are more focused in the clinical genetic EQAs. And this year, for the first time, we are running a new pilot EQA on metabolic disorders. And I've got a question about that. We have also as a panelist the EQA lead who's going to run this EQA. Dave, can you tell us a little bit more about that? Are you able to join in?
Yes, I'm here. Yep. Yeah. It's one of the, so this is one of the clinical genetics EQAs. It's going to incorporate biochemical results as well as DNA-based test results. That's slightly different. Obviously, it's for inherited metabolic disorders, and it's aimed, it would be suitable for clinical geneticists, but also for inherited metabolic disease services, where the clinicians deal directly with the genetic reports. and it's in development.
Okay, so yes, please, all of these EQAs are now open for enrolment. So if you want any more information about them, then please do send an email to info@Genqua, and we will be able to answer any questions, provide any more information. So Vigdis, we have a question here, well, and for you too, Francesca, about how variable the role of the genetic counsellor is within Europe, and if between the different countries, and if you can see as time goes on whether the role is increasing in some countries.
I think it's increasing in many countries, and maybe most countries where genetic counselors are, because everyone seems to understand that the role of the genetic counselor is, I don't know, very important in medical genetics. And I don't know about other countries, although I think I know that medical geneticists and doctors are really busy and usually have too many patients. So having someone that can take part of the job, and even though he or she does it differently from the medical geneticist, I think it's very important for everyone. And for me, I really hope that very, very many young people go into genetic counseling, because there's jobs everywhere.
Thank you. And as you saw in Francesca's talk, you can see that genetic counselling was very important and appreciated with all of the different disciplines. And for EQA purposes, we are going to try to rotate the case scenarios between the different disciplines. So we've had cardio, we've had an oncogenetics one, we've had this year's one was a monogenic type case, and in 2023 we're hoping to provide a prenatal case. So we will circulate the cases throughout the different disciplines, and in the future we might have perhaps 2 cases per year, and people can choose to do one or the other depending on their experience and their focus of their service.
Can I add something, Katrina?
Yeah.
For the other, you know, like the medical genetics cases, I think at least in my country, we participated with the medical geneticists. The genetic counselors and the medical geneticists work together on them, and I think that's also important, because we get to see how they solve problems, how the medical geneticists solve the problems, and with the added input from us. So I think that's something
it's nice to look at them together as a multidisciplinary team, isn't it? Like you say, you can learn from each other, or bring something different to the table to discuss. Okay, but we'll probably send out a survey to all of the participants to get feedback on what they think is important, and to make sure that we are delivering something that's appropriate and educative for them as part of the participation. Melody, can you see any other questions?
Yeah, there's a few more coming in now. So a common theme is about training. So we can combine 2 of them, I think. So one of them's asking if there's any online courses for genetic counselling, and one will obviously vary country to country, but what's a good way for an individual to gain experience, as internships and shadowing are often not possible for anybody who would like to become a genetic counsellor.
Right. There's an online training, at least through Cardiff in Wales, which means that the individual can stay at home, work at the hospital at home, and still participate in the masters, which takes about 3 years then to comply. And I'm not sure if other countries have online, but probably. I think it's on the site, on the medical genetics site at the ESHG. There's a list. which people can look at. As for the other part, how to shadow, well, if there's a medical genetics department at the hospital close to the person that wants to study genetic counseling, I think everywhere you could at least opt to stay in for a few days and talk to people to get to know more about the profession. Although it may be different between countries. I know Iceland is a bit forward. I know it's a small country and everyone knows everyone. But I think in other countries where, you know, people are mostly very happy if someone wants to do training in a medical profession. I'm not sure if it answers the question, but then.
Yeah, I think it will vary country to country, won't it? So,
Yeah.
But that's a good first point of call to approach them and at least ask the question.
Yeah, genetic counselors are very friendly people.
And are there some courses organised by the European Society of Human Genetics that are dedicated to counselling, Vigdis?
Not the society as it is, but it oversees. If you want to, you know, the overseas training and gives sort of, I'm not sure about the word here, certification to centers.
Right.
Yeah.
Okay. Were there any more questions, Melody, or not?
Yeah, so just to remind, I think somebody's got their hand up, but we won't be able to take, you'll have to type your question into the box for us to be able to see it because we aren't able to unmute everybody. And then there's another one, a general question, does language play an important role when it comes to genetic counselling and interacting with patients?
Sorry, I didn't hear that.
Does language play an important role when it comes to
Yes.
genetic counselling and interacting with patients?
Yes, language in the sense of how you talk to people. Obviously, the language depends on where you live. You have to at least speak the language of your homeland or where you live or where you work. And if you go to another country, it depends on what country it is. If you can use your own language or if you need to learn some other language. Icelandic is difficult, I know that, but so if you want to come to Iceland, you really have to learn Icelandic.
Thank you. And then another perhaps country-specific one, but the need for genetic counselling is increasing, but in some countries, only medical geneticists can give counselling. Will there be universal agreement on that in future? And there's no genetic counselling, only medical geneticist in some countries. So do you have an opinion on that?
I do. Everywhere that genetic counsellors meet and speak, they press the issue of getting genetic counselling into every country because, as I said before, it's really important. So I think as time goes by, it will be in more and more countries, even those that now only want medical geneticists to do this. They, as everyone else in the medical field, recognizes that there are just too many patients. So we have to have more people to support the patients. So in my opinion, yes, I think it will be an increasing number in every country. Hope so. So.
Thank you. And maybe I can ask this one to Katrina. How is the EQA assessment done for genetic counselling? Is it via role plays or is it a written assessment?
You mean the assessment
EQA,
or taking part?
The EQA taking part, I think they mean. How would they
yes, so it's
in the EQA?
Yes, so it's a case scenario based EQA, and it's done as a serial number of questions. So when you first open up the EQA, the first thing you will get will be a referral. It aims to replicate a patient pathway within the genetics counselling consultation, from their first presentation to you providing and following up counselling post diagnosis. So you get a referral letter, and you will get a certain amount of clinical information, and then you are asked to supply answers to some specific questions. And when you have answered those questions, you submit, and then that gives you access then to the next information that the patient will give you. So it's a stepwise questionnaire based on information that you learn through your consultation with your patient, and that's how it's organised. And you get points for the quality of your answers. So generally it's about 10 questions altogether over a number of different stages. So I hope that's answered your question.
Thank you. So I think that's most of the questions answered. So we've been asked if we can send links of any online training courses or genetic counselling programs. So we'll see if we can do that via the website platform, the webinar platform, or whether we just put that on our GenQA website. But we'll certainly look into that for you. And then the other one was a bit of feedback. So would there be any examples of challenging genetic counselling? So that that's something that obviously we haven't quite covered today, but we could cover that in a future webinar, which leads us to the fact that you'll be sent a survey by the webinar platform for any other feedback. So we'd be grateful for you to give your feedback. Those who have attended live today will also be automatically emailed a participation certificate. The webinar will be recorded if you missed any of it, or if you wanted to watch it again. So that link will be emailed to you. And also if any of your colleagues wanted to view the webinar, it will be available on our YouTube website, freely available in about a month. So that information will all be there if you want to review it or look back at it with your colleagues. Otherwise, I think we've answered all of your questions. Obviously, if you have any other questions, feel free to email GenQA on info@genqa.org. Have I covered everything? Katrina, have you got anything else to add?
Yes, I think that's covered it, and I think some of the questions also have enlarged the information that's out there. Okay. So just thank you very much for everybody for either taking part of the EQA or being interested enough to watch this webinar today. And a big thank you to Vigdis and for Francesca for giving up time to present to us today, and also for all the hard work in creating the case scenarios and marking the submissions. So thank you very much, everybody. And as Melody says, if you need any more information, please contact us, or we can forward some of the specific questions to Francesca or Vigdis if you need more personal input from them for your questions. So thank you very much, everybody. That's we can now close this webinar. Thank you.